So joining us now, we have Dr. Christopher Doring. He is the Vice President of Medical Affairs at Franciscan Health. Dr. Doring, thanks for being here.
Oh, thank you. Good to be with you, Mary.
So let's just jump right into it. We're talking about the flu, and flu season is coming up. So two questions. First, when does flu season begin? How long does it last? And do we know what kind of season is expected just yet?
Yeah, those are good questions. Traditionally, the flu season will start in the fall. The definition is that flu season starts once we start seeing activity of the influenza virus in the community. That's typically not until the fall, although we've already seen a couple of sporadic cases here this summer. Flu activity never completely goes away, but we certainly won't expect widespread flu activity till later in the fall. And then most years, it's really not until January or after that we see our peak flu seasons. Typically, it's run its course by March or April. So that's why we typically look at that sort of colder weather season as the most flu activity. The vaccine is already becoming available for this season, and the vaccine does change year to year depending on which viruses we're anticipating being active that year.
And that actually leads into my next question. So, right, we sort of anticipate or try to predict what type of strand it will be. I understand last year we sort of missed the mark a little bit. So how does that work? How do scientists make their best guess?
Yeah, so the flu activity spreads depending on which hemisphere is in their winter season, and so we look at what's going on in other parts of the world in the preceding winter months. During our summer, we try to target the vaccine to the virus that we saw circulating in those other parts of the world. That typically hits the mark, some years really well and other years not so well. So it depends on what the virus is doing from a, from a genetic mutation standpoint, or just a completely different virus may have emerged in the United States in a given year. We may just miss completely. Oftentimes, even if the virus isn't a perfect match, it does confer some protection, and so people might get the flu but not have as severe of an illness as they otherwise would have.
And from my understanding, the flu vaccine wanes over time. When is the best time in the season to get the flu vaccine?
Yeah, that's a great question as well. That can depend on the individual and the sort of the subpopulation that you're looking at and their health status. Typically, the immunity that a vaccine confers starts to wane after 3 to 6 months. And so timing when you get the vaccine is important. So if you get it too early, say you get it in August and the peak doesn't hit until February or March, your immunity might have waned by then. So I think a lot of physicians will recommend timing the vaccine sometime in late September into October.
And this year we have a double threat. We'll have flu season and we'll have COVID-19. How are we going to handle this?
Yeah, that's another great point, and one that we're all kind of bracing ourselves for. And certainly when COVID first hit, we were still in the middle of flu season this past year. So I think there is definitely a heightened urgency to getting vaccinated for the flu this year, since the vaccine is available, and that can help provide some additional protection and clarity around a given patient that may be experiencing flu/COVID-like symptoms. Certainly, we will likely be testing individuals who are exhibiting those types of symptoms for both COVID and flu once the flu season hits. And so definitely would expect a much greater turnout for the flu vaccine this year, maybe over past years, just because of COVID. Incidentally, one of the interesting things we've been seeing in the Southern Hemisphere this year is that flu seasons in many areas have actually been milder, in part because of the masking and the hand hygiene and the heightened sense of protection that people are taking that can help stop the spread of any virus, not just the COVID virus.
So Dr. Doering, we'll leave it right there. Thank you so much, and we'll see you again soon.
Oh, absolutely. Happy to come on anytime.
Absolutely. Thank you again.
All right. We'll see ya.